Metabolic syndrome is a group of conditions. These conditions occur together. They increase your risk of serious health problems. These problems include heart disease, stroke, and type 2 diabetes. Think of metabolic syndrome as a warning sign. Your body is telling you something is wrong. It's time to take action. You can prevent or reverse metabolic syndrome. Lifestyle changes are key. The syndrome is diagnosed when you have 3 or more of the following: high blood pressure, high blood sugar, excess fat around the waist, high triglyceride levels, and low levels of good cholesterol. Metabolic syndrome is becoming increasingly common. This is a global health concern. It affects millions of people. Recent studies show that metabolic syndrome significantly increases the risk of cardiovascular diseases. These studies highlight the urgent need for lifestyle changes to combat this growing issue. A study published in the Journal of Metabolic Health found that regular physical activity can reduce the risk of metabolic syndrome by 30%. Another study in the American Journal of Clinical Nutrition showed that a diet rich in whole grains and vegetables lowers the risk of metabolic syndrome. Research from the Sleep Foundation indicates that adequate sleep is crucial for metabolic health. To improve metabolic health, include these foods in your diet: leafy greens, berries, nuts, seeds, whole grains, and lean proteins. Making these changes can help you take control of your health and reduce the risk of metabolic syndrome. Here are the 5 markers to check for in men and women for your metabolic health. 1. Waist circumference, men 40 inches, women 35 inches. 1. Triglycerides, 150 mg/dl. 1. HDL cholesterol, men 40 mg/dl, women 50 mg/dl. 1. Blood pressure, 130/85 mmHg. 1. Fasting glucose, 100 mg/dl. Several factors can increase your risk. These include obesity, especially excess belly fat, physical inactivity, and an unhealthy diet high in processed foods, sugar, and unhealthy fats. Insulin resistance, where your body doesn't use insulin properly, is also a factor. Age and genetics play a role too. Family history increases your risk. The risk also rises as you get older. Certain medical conditions can contribute. These include polycystic ovary syndrome, or PCOS, and non-alcoholic fatty liver disease. Metabolic syndrome is a global health issue. It affects both developed and developing countries. The World Health Organization estimates that 25% of adults worldwide have metabolic syndrome. Urbanization and unhealthy lifestyles are major contributors. As more people adopt westernized diets and sedentary lifestyles, rates of metabolic syndrome rise. The good news is that metabolic syndrome is preventable. Lifestyle changes can make a big difference. Preventing and managing metabolic syndrome starts with you. Here are some key lifestyle changes. A healthy diet. Eat plenty of fruits, vegetables, and whole grains. Limit processed foods, sugary drinks, and unhealthy fats. Regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Weight management. If you are overweight or obese, losing even a small amount of weight can help. Stress management. Find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. Recent research highlights the importance of sleep. Aim for 7 to 8 hours of quality sleep each night. Dietary fiber. Increase your fiber intake from fruits, vegetables, legumes, and whole grains. Limit ultra-processed foods. Minimize your consumption of ultra-processed foods, which are often high in unhealthy ingredients. Remember, small changes can make a big difference. Start today and take control of your metabolic health. Thanks for watching. If you found this video helpful, hit that like button and subscribe for more health tips and expert advice. Don't forget to turn on notifications so you never miss a new video. Have questions or thoughts? Drop a comment below. We'd love to hear from you. Stay healthy and see you in the next one.